Good afternoon, staff. This is Mrs. Taylor, your school counselor. The next presentation that I have is suicide intervention. Please be aware of our mission statement as well as our vision statement. And since I shared it earlier with our bullying presentation, I will not share the mission and vision again. Today, we will define and understand suicide and how it affects students. Understand the risk factors and warning signs, understand GCS suicide intervention process and procedure, define and understand suicide postvention, review the referral and intervention process. Disclaimer, we understand that suicide is a difficult topic to discuss. If you need assistance, please get help. Each school has trained staff members that are familiar with this in-service training and are available to answer questions. So here's some terminology that you need to be aware of. Suicidal ideation, any self-reported thoughts of engaging in suicide-related behavior. Suicide plan, a systematic formulation of actions that could result in self-injury. Suicide attempt, a self-inflicted potentially injurious behavior with a non-fatal outcome, which there is evidence, either explicit or implicit, of intent to die. A suicidal student wants to stop the pain, sees suicide as the ultimate escape or the only solution from the problem or pain, usually gives clues, subtle or obvious, about wanting to harm themselves, feels ambivalence, wants to live but wants to die, so they have mixed feelings. According to the 2019 Child Health Report Card, the following was highlighted. The rate of youth suicide has doubled in the previous decade. Factors leading to suicidal thoughts include mental health, trauma, persistent stress, family violence, bullying. 12% of heterosexual youth reported seriously considering suicide, compared to 43% of LGBTQ youth. African American youth were twice as likely as white youth to have attempted suicide in the past year and were significantly less likely to get treatment for depression. The impact of COVID-19, according to the CDC, also had an effect on suicide. Financial hardship, job loss, increased number of deaths, feelings of grief and loss, increased anxiety, increased stress, feelings of isolation due to social distancing, fear and worry about your own health and the health of your loved ones, changes in sleep or eating patterns, difficulty sleeping or concentrating, worsening of chronic health problems, worsening of mental health conditions, increased use of tobacco and or alcohol and other substances. Warning: at-risk observations and behaviors in a virtual setting. What to watch for in a virtual environment. Behavior that is out of the ordinary for the student, increased irritability, mood swings, change in appetite, change in sleeping patterns, negative response to recent change in structure and routine, change in physical activity level, change in communication with family members, change in work study habits. Risk factors and warning signs. So we have two types of risk factors. They are chronic and acute. Chronic risk factors are factors that increase one's risk over their lifetime of being suicidal. Acute risk factors are factors that are associated with greater risk in the near future of being suicidal. The risk factors are the warning signs of suicidality. More warning signs and chronic risk factors: prior suicidal activity, cognitive deficient, mood disorder, anxiety disorder, personality disorder, cognitive deficits, poor coping skills, substance abuse, self-injurious behavior, social interpersonal isolation, alienation, and hopelessness. Warning signs for acute risk factors include rage, uncontrolled anger, feeling hopeless, revenge-seeking behavior, increased drug or alcohol use, engaging in reckless activities, withdrawing from family and friends, feeling trapped, anxiety, agitation, disturbed sleep patterns, dramatic mood changes, no sense of purpose in life, feeling like there is no way out, and focusing on death. Teachers and staff, please be aware of student communications. Be mindful of students' writings. Report immediately to your school counselor or principal any distress writing, disturbed writing, or threatening writing. The GCS response to suicide. If you feel a student is in danger, contact SIT trained staff immediately. The SIT trained members in our school are Mrs. Sims, Mrs. Allah, and myself. A person must be GCS SIT trained to conduct suicide intervention interview. Staff is trained to determine the lethality of referred student, assess the level of lethality, and make an appropriate referral. Suicide intervention training is offered annually to licensed employees. We need to teach students that talking about suicide won't increase suicidal activity, not to keep secrets that a peer is considering or planning to die by suicide. A true friend would do everything possible to keep a friend safe, like break a promise of secrecy. Suicide postvention. Postvention is follow-up intervention conducted after a suicide crisis. This includes threats, attempts, or deaths by suicide. Focuses on prevention measures used for those who have been affected by the tragedy. The goal of postvention is to prevent post-traumatic stress in students and contingent. At-risk students include acquaintances of the victim, ones who have experienced loss, had prior suicide attempts, intentionally self-injures, delinquent behavior, and experimenting with drug and alcohol use. Referral and intervention process. You need to be aware that the process that I'm about to share with you is from remote, when we were remote last year. And also, if a student is at home and makes a statement of self-threat. This presentation has not been updated to include what we would do if we were in school, but I will talk you through that. If a person receives information through any mode of communication, call, text, email, chat room, etc., that a student could be in danger, they must do the following. Immediately contact, call, or email the principal and the SIT-trained members of the school, which includes at our school, myself, the school counselor, Mrs. Sims, our school social worker, and Mrs. Allah, our Success at Schools director. The SIT-trained members will contact the student and parent and guardian about the referral as soon as the referral is received. SIT-trained members will provide resources to the parent and guardian and extend additional supports to the student when they return to school. These may include weekly check-ins, individual counseling sessions, small group counseling. The SIT train members will collaborate with the parent and guardian to secure a two-way consent with the student's healthcare provider and to develop an action plan. SIT train members will complete all the SIT paperwork. They will make sure that all SIT forms are completed and interventions are documented. All documentation must be kept in a secure location. At school, in person, if you hear a student make a comment of self-harm or a threat, you need to let our administrators know, and you need to let a member of the suicide intervention team know. And that includes Mrs. Sims, Mrs. Allah, or myself. We will conduct an interview with that student in person. We will call their parent, and everything else that I shared when the student returns to school will be provided to them to support them. If there is imminent risk of a suicide attempt, the person receiving the information will immediately contact 911 to report the situation and to request intervention. That's virtual or in person. Information to be given to 911 includes the student's name, address, and phone number if known, as much as possible about the situation. If school, you just give the location of the school. Following the call to the police, the person would immediately attempt to contact the student's parent and guardian to inform them of the situation and inform them that the police has been called. The person will inform the principal of the referral and actions taken. The principal will inform SIT trained members, school counselor, school social worker, school psychologist, etc. of the incident. SIT trained members will contact the parent and guardian to extend support, secure a two-way consent with the student's healthcare provider, and develop an action plan. SIT trained members will complete all the SIT paperwork. They will make sure that all SIT forms are completed and interventions are documented. All documentation must be kept in a secure location. So 911 is to be called if a student's lethality is very high, and they have a plan, and they have the method to execute their plan. Confidentiality and follow-up. School staff should maintain confidentiality. Need to know basis for communicating to others. Student will probably be told who referred. Student safety plans, action plans will be shared if needed to support students. Contact SIT trained members if you have concerns. Pay attention to writings and online behavior. All right, this comes to the end of our presentations. Please let me know if you have any questions, comments, or concerns. This is the end of this presentation. Thank you so much.